everybody, my name is Nozibeda Kamganamayaba. Welcome to my YouTube channel. Guys, thank you so much for tuning in. Today, I wanted to cover another different topic. I wanted to talk about HIV and opportunistic diseases. So I was diagnosed with HIV August of 2013, and I will say for the first 2 years, I did not know what was going on. All I know is that every 6 months I needed to go to the doctor, and he will draw blood samples, send them to the lab, and then call me after a couple of days and say everything was fine. But as I was progressing, in my journey, I started wanting to learn more. I wanted to know how I can better take care of myself. I wanted to know what the blood samples were. I wanted to have a better conversation with my doctor. So I started asking more questions. What are you looking for? Am I at risk of something else besides HIV? That's when he started explaining so many different things and what the blood samples were and why I was getting checked, every 6 months and then eventually once a year. So the first thing that they said is the most important is that we are checking your viral load and CD4 count. Starting with the CD4 count. CD4 count basically measures the amount of white blood cells that are in your body. So these are the cells that fight off infections, And then the viral load basically measures the amount of the virus that is inside your body. Those are the basic things that are being measured for a person living with HIV to determine whether this person is healthy or not. In addition to that though, because our immune system is compromised, we are at risk of getting opportunistic diseases. So I wanted to talk about some of the opportunistic diseases that you should be aware of. But please guys, note that this does not constitute as medical advice. This is me trying to come out and ignite and inspire that you guys have a better conversation with your nurse so that you know what is going on, so that you know the condition that you're living with better. So the first opportunistic disease that I'm going to cover is diabetes. To better understand what diabetes is, a simple example would be we eat food and then it gets digested, right, into what we call glucose. Glucose or blood sugar, okay? This is meant to go into our cells, different cells in our body, basically allowing our body to function. It gives our body energy. This passes through our bloodstreams and into our cells. Now, when you have diabetes, this process is not working well. So instead now the glucose to go into your cells, to the rest of your body, it now builds up into your blood streams, into your blood cells. This is very dangerous because now your body is not going to function because it does not get the energy that it needs. Also, with the glucose building up and not being regulated, it damages now your blood cells, okay? In that case, then that is when you get high glucose level in your blood and then you are diagnosed with diabetes. Now, I know diabetes, guys, is that there's so many different ways that you can get it. It's genetic. So if your mom, your dad, or several family members have diabetes, then chances are you're also going to be at high risk of getting diabetes. But it also depending also on the lifestyle that you live. If you are someone that is overweight, you do not eat healthy, you are not active, then the chances of you getting diabetes is also very high. Additionally, now, as someone who's living with HIV, I'm also considered at a higher risk of getting diabetes. Now let's talk about some of the symptoms of diabetes. It says here include increased thirst, frequent urination, increased hunger, weight loss, tiredness, blurred vision, slow healing sores, or frequent infections. Diabetes can also contribute to sexual problems, including problems getting or maintaining an erection, vaginal dryness, and other issues. Now guys, please don't panic because I know what is going to happen. As a person living with HIV, you get tired and then now you think you have diabetes, okay? That is not the case. However, if you find that you identify with 90% of the symptoms that I have mentioned, then I would definitely advise for you to go and consult with a doctor, a nurse, a clinic, to please do a diabetes test. Now, for a person that is living with HIV, what I will advise is that as part of your routine test, the doctor, the nurse, the clinician will test your glucose level and will give you a test called the hemoglobin A1C, which gives an average of the glucose level over the period of 12 weeks. This will indicate whether your glucose level is normal, higher, then right there it is determined whether you you are diabetic or not, or you have diabetes rather or not. Okay, if you are diagnosed with diabetes, in addition to the medication that they are going to give you, I'm going to also just point out a few things on how you can manage it. The first thing is that you need to maintain a healthy weight. I know this is always debatable, okay guys. What I mean about that, it doesn't mean now you need to go on a fast, okay, so that you can be a size 30. I could never be a size 30. I'm a size 36 on a good day, but possibly a 38, okay? So maybe a good weight, but this is when you have to definitely consult a dietitian, you know. A good weight might be a size 34 for me, okay? Or even maintain at a size 36, considering also the amount of, you know, of fat, of body fat that I have, considering also my age, okay? The second thing is that you need to exercise regularly. So it doesn't mean now you're going to go and run your comrades, okay? It literally means that if you now usually go out to buy bread using your car, you can just walk to the shops, you know. Make sure, usually they say you have to make sure that you walk 10,000 steps a day, just to keep the blood flowing, okay? And then the last thing is that eating a healthy and balanced diet. Once again, always debatable, always controversial. Eating a balanced diet is very expensive. Eating healthy is very expensive. It's just the little things that you need to count. Usually it's about even the portions, you know, that you eat. Instead of having more potatoes, making sure that you have more carrots, you know, it's about how you even cook your carrots. I know for a fact that back home, mom usually says my carrots, as vutwanga, they're not cooked properly, because I like more like just a little bit of tiny water, or even steam them, you know. Yena, she likes a whole gallon of water and then also sugar on top of that. And then, so it's those little things that you just have to adjust and make a difference, which will ultimately make a difference in terms of how you live and protect yourself even further. And the second thing that I wanted to talk about is HIV and liver damage. There is a term that is called hepatotoxicity, which is a medical term for damage to the liver caused by medication. Okay, so now that you are living with HIV, you are going to start ARV treatment. Now, studies have shown that some, please highlight, some HIV medication may cause liver damage in the long run. So what is being done, that as soon as you are diagnosed with HIV, clinicians will check what is called hepatitis B virus infection and or hepatitis C virus HCV infection. So before you even start HIV medication, that is what is going to be checked to determine whether or not you are at risk of developing a liver failure or liver damage or hepatitis B virus infection or hepatitis C virus infection. In such a case, if you are at risk of that, then clinicians will have to definitely change the dosage that they give you in terms of ARVs. That is why my ARVs is very much different to the dosage that as the second person is at, because in medical history too, and in terms of where we are, CD4 count, viral load, just overall assessment is very different. So those are the things that you need to note. Some of the symptoms of a liver damage: rash, stomach pain, nausea and vomiting, fatigue, dark colored urine, light colored bowel movements, and yellow skin and yellow eyes. Once again, it doesn't mean that if you have rash, then all of a sudden now you have liver damage, okay? But one definitely symptom that you can look out for as a person living with HIV that is on ARV treatment is that yellow skin and eyes. I remember there was a follower of mine that sent me an inbox to say she actually suffered from this. She had a liver damage, and to a point where now they needed to change her medication. It doesn't mean that you're going to stop your ARV treatment. You're going to continue, but they may change your dosage. Similarly to the liver damage will also be the case when it comes to kidneys. Some ARVs may cause kidney failure or kidney problems in the long run. That is why, as part of your routine routine check, the doctor will either ask you to do a urine test or a blood test to check that the kidneys are functioning properly. And if there's any indication that there is a kidney failure or there's something wrong with the kidneys as a result of the ARVs, they will once again change your dosage to a different dosage. Let's talk about HIV and TB. Guys, particularly in South Africa, this is a concern. A lot of people that are living with HIV are actually passing away from TB. Your immune system is already compromised, meaning that you're most likely to get TB. So what are some of the symptoms of TB? If you're experiencing any night sweats, fever, chills, weight loss, loss of appetite, weakness or fatigue, chest pain, or a persistent cough that may bring up blood, for over 2 weeks, then definitely consult with your doctor. And the last one that I wanted to talk about is HIV and cervical cancer. Guys, particularly in the Black community, we don't talk enough about cervical cancer. I think breast cancer has gotten more traction. I don't think cervical cancer has reached the level where there's more awareness around cervical cancer. It's actually number 2 behind breast cancer affecting women in South Africa. And also stats show that 64% of the cervical cancer cases in South Africa were women that were living with HIV. So that's how severe it is. Women that are living with HIV are 6 times more highly to be diagnosed with cervical cancer than women that are HIV negative. Cervical cancer is caused by infection from the human papilloma virus, otherwise known as HPV. It is a sexually transmitted infection. Not all HPV infections causes cancer. Some infections, if you get it, can clear over time, but there are those cases where it doesn't, and for that reason it will develop into cervical cancer. As a woman living with HIV, I'm more likely to acquire an HPV infection and less likely to actually clear it out. You are more at risk of also developing cervical cancer if you are not on treatment and your CD4 count is very low. So that is why it's very important to please make sure that you continue to take your ARVs. If you don't, then your immune system might not be able to clear out an HPV infection. Now, early diagnosis is very important when it comes to cervical cancer. That is why you continuously need to make sure yearly you go for your pap smear, okay? I know, guys, it's very uncomfortable. Having something up your vagina is not nice, okay? Except for that other thing, okay? It's not nice, it's very uncomfortable, but it is very important because, as we say, early detection. If they see there's cancerous cells around the cervix, there's something that is worrisome, then they're able to detect that very early and do something about it. There's also what we call an HPV vaccine. So an HPV vaccine may lessen the chances of you getting cervical cancer, but then you can only get it if you have never had an HPV infection. If you've had, then it's not going to be effective. Thinking about HPV vaccines, I remember, I think it was around 2014, when there was this whole campaign in South Africa that girls from the ages or from grade 4 should get HPV vaccine, and it was a whole rollout that I was actually very excited about, meaning that our girls are going to be, there's just going to be some kind of protection for them in terms of cervical cancer. But I guess again, over time, now with the development of COVID, that has kind of died down, because I haven't seen any other articles talking about, they're still rolling out these HPV vaccines, but I am hoping that on the ground it is still happening. So those are some of the, opportunistic diseases that you should note. I'm sure there's more, but those are the key ones that I would love definitely, when you're going for your next visit to your doctor to talk about, cervical cancer. It'll actually be a nice conversation so that you can also better just understand some of the stats, that the doctor might give you. Talk about TB, diabetes, liver damage, kidney damage as a result of the, ARV treatment. It's a better conversation when you are empowered. So guys, I hope that helps. I'll see you next time. Thank you so much for tuning in.